bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Welcome to another edition of Comcast Newsmakers. I'm Mark Curtis. We have a very interesting and important medical issue to talk about today, and that is postpartum depression. Not necessarily in women, but in men. This may surprise you, and with us to talk about it is Dr. Will Courtenay, who's a psychotherapist in Berkeley. Good to see you, Doctor. Thanks for being here.
Well, thank you, Mark. It's a pleasure to be with you.
Postpartum depression is something we've known about for years in women who have just had babies. How common is that in women?
Well, it's fairly common, but it's surprisingly common in men. It's almost as common as it is in women. Anywhere from 1 in 10 to as many as 1 in 4 new dads experience postpartum depression. So what that means is that each day in the United States, as many as 3,000 new dads become depressed after the birth of their child.
I've never heard about this before. I assume it has always existed, and maybe people didn't want to talk about it or didn't recognize it. Why is this such a new issue?
Well, I think it's exactly that we haven't talked about it. It's not commonly recognized. Even a lot of mental health professionals don't even know that it exists. But as I said, it's fairly common. And when we talk about as many as 1 in 4 new dads who experience it, it's a fairly common condition.
What are the symptoms? What are the causes? Give us a sense of what we would recognize.
Well, the signs are actually very important to talk about because they're not so easy to spot. When we think of depression, we usually think of somebody sad and crying. But picture instead somebody who is a man who is working 60 hours a week, a little irritable most of the time, drinking a couple of martinis at lunch, slipping out of the office to have an affair, and then speeding home to his wife in the evening. Now, that's not what we normally think of as depression, but those are some of the signs of depression in men. Now, we also see some of the more classic signs, such as a sad mood or a sense of loss of self-worth, loss of interest in pleasurable activities or sex, and thoughts of suicide. But it's really important to remember that men are more likely than women to try to hide depression.
I was going to ask about that. Is there a stigma attached to it, and men might not go for mental health treatment in general, let alone this? And how do you break down that barrier?
Well, it's a great question. And yes, most of the people who seek mental health services are women. Fortunately, increasing numbers of men are recognizing that they need to get help when it's time to get help, especially in a condition like with depression, which is a medical condition that is very treatable.
Let's talk about the treatments, because sometimes when we get into mental health areas, people say, well, counseling is enough, or do we need to prescribe antidepressants or actual medicines, or is it a combination of both? How do you know?
Well, research certainly shows that talk therapy is very effective in treating depression, and often in conjunction with medication as well, those two. And of course, there are a whole range of treatments from traditional to alternative. Really, the important thing for men is that they actually get help, and preferably from a licensed mental health professional.
I have 2 children who are now teenagers, and I'm trying to think back to just after they were born and how I was feeling and whether I was depressed. I don't think I was. But I did feel a tremendous sense of new responsibility that I hadn't really anticipated. And part of me said, are you going to be able to step up to the challenge? So, is that one of the symptoms, perhaps?
Well, that might be one of the causes. We're just starting to learn about what some of the potential causes are, and that might be one of the causes. Changing social expectations for men. We expect dads to be much more involved in parenting than ever before. And, most dads I talk to say, sure, I want to be involved. But then they think, what does that really mean? The fact is, most of us had dads who had a completely hands-off approach to parenting. Right. So that leaves a lot of dads uncertain about what they're supposed to do. Now, that uncertainty can very quickly lead to anxiety, and we know that anxiety postpartum often leads to depression.
Real quickly, we're almost out of time. Where can folks get advice, or give us your website? Where can we get more information?
Well, the best place to get information is from the website, which is saddaddy.com. There's lots of information about postpartum depression in men. There's also a self-assessment men can complete to see if they might be depressed. There's also a forum for men to talk with one another, which is an important part of their recovery.
Okay, Dr. Will Courtenay, thanks for being with us today on a very important issue. Thanks for being with us on Comcast Newsmakers.